Progesterone in miscarriage. Can progesterone supplementation prevent miscarriage? Introduction. Miscarriage, the spontaneous loss of a pregnancy before the 20th week, is a devastating experience for expecting parents. It is estimated that about 10–15% of recognized pregnancies end in miscarriage, and this figure could be even higher when accounting for early miscarriages that occur before a woman even realizes she's pregnant. Understandably, there is a great deal of interest in understanding the causes of miscarriage and exploring potential preventive measures. One topic that has garnered significant attention in recent years is the role of progesterone in preventing miscarriage. Progesterone is a hormone produced by the ovaries and plays a crucial role in maintaining pregnancy. In this essay, we will delve into the relationship between progesterone and miscarriage, exploring the scientific evidence and controversies surrounding progesterone supplementation as a preventive measure. Understanding progesterone. Before we dive into the relationship between progesterone and miscarriage, it's essential to understand the role of progesterone in pregnancy. Progesterone is a hormone that prepares the uterine lining for implantation and supports the early stages of pregnancy. It helps to maintain the uterine environment, ensuring it remains receptive to the growing embryo. Progesterone is primarily produced by the corpus luteum, a temporary endocrine structure that forms in the ovary after ovulation. Once an embryo implants in the uterine lining, the placenta takes over progesterone production to sustain the pregnancy. Progesterone helps relax the uterine muscles, prevents contractions, and supports the development of the placenta and fetal membranes. Understanding miscarriage. Miscarriage, also known as spontaneous abortion, can occur for various reasons. While some miscarriages are due to chromosomal abnormalities in the embryo, others may result from structural problems in the uterus or hormonal imbalances. It's essential to differentiate between early miscarriages, often occurring within the first trimester, and late miscarriages, after the first trimester but before the 20th week. Progesterone's role in miscarriage prevention primarily focuses on early miscarriages. The role of progesterone in early pregnancy. Progesterone's role in early pregnancy centers on maintaining the uterine environment necessary for the developing embryo. It helps to sustain the uterine lining. Progesterone ensures that the uterine lining remains thick and receptive for implantation. Without adequate progesterone, the uterine lining may not provide the necessary support for the embryo, leading to implantation failure. Suppress uterine contractions. Progesterone relaxes the uterine muscles, preventing contractions that could potentially disrupt the implantation process or lead to miscarriage. Support the placenta. As the pregnancy progresses, the placenta takes over progesterone production, further stabilizing the pregnancy and providing essential nutrients to the developing fetus. Modulate the immune system. Progesterone also plays a role in modulating the maternal immune system to prevent it from rejecting the embryo as a foreign body. Given the critical functions of progesterone in early pregnancy, it's understandable why researchers and clinicians have explored the possibility of using progesterone supplementation as a preventive measure against miscarriage. Progesterone supplementation, the controversy. The idea of using progesterone supplementation to prevent miscarriage has been a subject of debate within the medical community for decades. While some studies and clinical trials have suggested potential benefits, the evidence is not without its limitations and conflicting results. 1. Efficacy in recurrent miscarriages. One area where progesterone supplementation has shown some promise is in cases of recurrent miscarriages. Recurrent miscarriage is defined as the consecutive loss of 3 or more pregnancies. Some studies have suggested that progesterone supplementation may be beneficial in this specific subgroup of women. Lack of universal benefit. However, when it comes to the broader population of women with a history of miscarriage, the evidence is less clear. Not all women who have experienced a miscarriage will benefit from progesterone supplementation. It appears that the effectiveness of progesterone may depend on various factors, including the cause of the miscarriage, the woman's age, and the timing of progesterone supplementation. Timing matters. The timing of progesterone supplementation also plays a crucial role in its potential effectiveness. Some studies suggest that early supplementation before conception or immediately after a positive pregnancy test may be more beneficial than starting it later in pregnancy. Lack of large-scale randomized trials. One significant challenge in assessing the efficacy of progesterone supplementation is the absence of large-scale, randomized controlled trials that provide definitive answers. Many studies in this area are relatively small and may have methodological limitations. Side effects and risks. Progesterone supplementation is generally considered safe, but like any medical intervention, it is not without risks. Potential side effects may include fatigue, dizziness, mood swings, and local irritation at the injection site, for intramuscular progesterone. It's essential for women considering progesterone supplementation to discuss potential risks and benefits with their healthcare provider. Conclusion. The relationship between progesterone and miscarriage is complex, and there is no one-size-fits-all answer to whether progesterone supplementation can prevent miscarriage. While it has shown promise in some cases, particularly in women with recurrent miscarriages, its effectiveness varies among individuals. If you have a history of miscarriage or are concerned about your pregnancy, it's crucial to consult with a healthcare provider. They can evaluate your specific situation, consider potential risk factors, and discuss whether progesterone supplementation may be an appropriate option for you. Ultimately, the prevention of miscarriage involves a holistic approach that considers various factors, including genetics, lifestyle, and overall health. Progesterone supplementation may be a part of that approach for some women, but it is not a guarantee of a successful pregnancy. Ongoing research in this field may provide more clarity in the future, but for now, individualized care and informed discussions with healthcare providers remain essential in addressing the complex issue of miscarriage prevention. Thanks for watching.